Hi, I'm Dr. Tara Guretzky. I'm a pediatric ophthalmologist and mother of 2 children at MCPS. I'm urging you to consider bringing children back into the schools. I'm going to talk to you today about our experience working throughout the pandemic, to the number of problems I'm seeing associated with virtual school, and the fact that children at the lowest socioeconomic levels are more at risk of these problems. So first of all, our experience working through the pandemic, it was scary at first. I mean, our staff and our technicians and doctors, we were afraid of contracting COVID or coronavirus. And so we immediately began to modify our technique in our waiting room. We spaced things apart 6 feet. We modified the sanitation technique, and we all wore masks. And I know a lot of you are concerned that children don't wear masks, but we found it to be the opposite. Children understand the severity of the disease, and they're quite willing to wear a mask to protect themselves and to protect others. So second of all, I've been seeing an alarming rate of vision problems associated with virtual learning. Headaches and eye pain and eye strain, as well as worsening nearsightedness. These problems aren't necessarily fixed by blue blocking glasses that you can buy on the internet. They're problems associated with the lengthy screen time that kids are getting in virtual learning. Kids are spending 6 to 8 hours a day on screen times when the American Academy of Pediatrics recommends no more than 2 hours a day. And this doesn't even include entertainment time. Now, myopia is very common, or nearsightedness as it's called. Some of you are probably nearsighted, but when it gets to a high rate, a high level of -5 or greater, it's associated with potentially blinding conditions such as retinal detachments, glaucoma, and macular degeneration. And I've been seeing kids coming in with higher rates than nearsightedness than normal, and it's progressing at a high level. Now, there are potential treatments to slow down nearsightedness, but these treatments are costly. They're expensive contact lenses or expensive drops that cost over $1,000 a year, and Medicaid and private insurances companies don't cover them. So these children are potentially, at risk, and the kids at the lowest socioeconomic levels are at a particular disadvantage. And I would just ask you, if you imagine yourself as a parent and receiving the news that your child has gotten worse and it's not reversible and they're potentially at risk of these problems, how do you decide between continuing your education or protecting your child's eye health? So again, I urge you to open MCPS for at least some groups of children.